Hi guys. Well, this is my website that is trying to advocate for the improvement of the public health system, and the name for the website is Health-For-All-Panama. Let's go to the mission section. Well, the mission for the website is very simple. That is that I'm trying to advocate for the improvement of the public health system because it has three main problems, that it is the long wait times, the lack of infrastructure, and the poor distribution of the facilities around the country. And it needs to be improved because many people use this public health system and they are not getting the quality medical attention that they need, and it needs to be improved. Let's go to the author section. In here is a video that talks a little bit about me and why I'm doing this. Here is also a little paragraph that also basically says the same thing, but let's look at the video. Hi, my name is Miguel Mendez. I'm 19 years old and I live in Panama City. The main goal of this website is to advocate for the improvement of the public health system in Panama. You may be wondering why. Well, one day while I was watching the news, I saw coverage about the public health system and how the problems it has affects the many citizens that use it. So I was very surprised when I saw it because this is something that I'm not very used to, because many of us go to private hospitals where these problems do not exist. With this website, what I'm trying to do is raise the voice of many people that need the public health system to improve because it's their only way of getting the medical attention that they need. Well, then let's go to the identifying the problem section. Well, in here, I talk about the three main problems, that is the long wait times, the lack of infrastructure, and the poor distribution of facilities, and a little description about why are these problems existing in the country. Then let's go to the impact. Well, in the impact section, we can see how these problems affect the many citizens that use the public health system. Well, in it, we can see that the median wait time for the medical attention was 60 minutes in a research study made by ENSPA. Also, the lack of infrastructure and how the hospitals that the public health system has are outdated and they need to be renovated because they don't have the necessary equipment and the necessary numbers of hospital beds to give the required treatment for their patients. Also, the poor distribution of facilities, that in many areas of the country there are not enough hospitals, and the many hospitals that they have are in bad shape, so they need to be renovated and they need to be improved. Then let's go to the solution section, and in it we can see some solutions to the three main problems. Well, in this one, the first solution, it talks about a priority system that it was implemented in a hospital in Brazil, that it decreased the median wait time drastically. And in it, you can, if you click here, you can go directly to the study and see this graph that shows how it decreased throughout the years. Another solution is that the many hospitals that we have, that the public health system has, they need to be renovated and they need to be given the necessary equipment so that they can give the quality medical attention that the citizens need. And also how building more hospitals in those regions and also in the main regions like here in the city can help uh, improve the medical attention of the public health system. And finally, the last solution is that also in those areas where not enough uh, hospitals, you can implement the use of mobile clinics, and these mobile clinics will go to those areas and make the people that live there have the the medical attention more easily, because if not, they have to travel a long distance to get the medical attention that they need. Well, let's go to the how can you help section. And here there are three ways that you can help. Well, you can contact the authorities, and here are the emails and also a telephone number in it that you can report those problems that you have in the public health system. Also, you can see some related cases of other countries that had these similar problems and how they solve it. And lastly, you can join the movement. And how and you may be wondering how you can join the movement. Well, here in the join the cause section is a forms that you can fill out and you can join the movement. Finally, we have the bibliography, which is all the works cited throughout the website. And finally, in the suggested readings, here are two news coverages by La Prensa that show these problems and how they are affecting the many citizens that use the public health system. Well, guys, I hope you like it. I hope you go to the website and join the movement. Thank you.